This is the CHEERS Workplace Violence, Harassment, and Sexual Harassment Prevention Program. Thank you for taking the time to complete this important occupational health and safety training. During this presentation, we will review the Workplace Violence, Harassment, and Sexual Harassment Prevention Program, which is articulated in CHEERS Personnel Policy 5.21d. We will review worker responsibilities, procedures, and the various controls in place to mitigate the risk of workplace violence. We will review the process CHEERS undertakes to assess potential risks and to obtain information from workers through collection of data and staff surveys. We will also discuss the process to assess risk that is embedded into CHEERS clinical practices. And finally, we will discuss the inherent risks associated with working alone, as this is sometimes a frequent requirement of the job. The Workplace Violence, Harassment, and Sexual Harassment Prevention Program is more than a policy, but rather a comprehensive program that includes the following elements. Number 1. Definitions to promote knowledge and understanding of what constitutes workplace violence, harassment, and sexual harassment. Number 2. Code of Professional Conduct, which includes not engaging in acts of workplace violence or harassment, and a progressive discipline process to address conduct violations. Number 3. Risk assessment procedures that are undertaken to identify potential sources of workplace violence. Number 4. Hazard Registry, which outlines the procedure for communicating hazards and identifying appropriate controls. Number 5. Procedures and tools for summoning immediate assistance. Number 6. A defined process for reporting concerns or incidents and procedures for investigating any incidents. Number 7. Training, including an introduction to the Workplace Violence Program during Day 1 orientation and follow-up trainings about the program as required. Number 8. Crisis intervention training. At CHEERS, this is our safe management training. Number 9. Separate policy and procedures for working alone. Number 10. Precautions related to protecting workers from domestic violence. Workplace violence is defined as the exercise of or the attempt to exercise physical force by a person against a worker in a workplace that causes or could cause physical injury to the worker. A statement or behavior that is reasonable to interpret as a threat to exercise physical force. An act of aggression that causes physical or emotional harm, including assault, threat, and abuse. There are 4 types of workplace violence, and our response to each in relation to the controls that might be employed varies. The first is external. This is when the source of workplace violence comes from strangers or people with no ties to the workplace. The second is client-related, which includes client aggression towards a worker or another client, worker-to-client aggression. The third is employee-related, which can involve anyone who has an employment relationship. And the fourth is domestic violence, personal relationship, which is the use of violence or threats of violence against a worker in the workplace by intimate partners or family members. Workplace harassment is defined as engaging in a course of vexatious comments or conduct against a worker in a workplace that is unwelcome or should reasonably be known to be unwelcome. This often includes unwelcome words or actions or a pattern of behaviors against a worker or group of workers that are offensive, embarrassing, humiliating, or demeaning. Sexual harassment is defined as engaging in a course of vexatious comments or conduct against a worker in a workplace because of sex, sexual orientation, gender identity, or gender expression, where the course of comment or conduct is known or ought reasonably to be known to be unwelcome, or making a sexual solicitation or advance to the worker that ought reasonably to know that the solicitation or advance is unwelcome. This is the list of responsibilities as outlined in the Workplace Violence, Harassment, and Sexual Harassment Prevention Program. Please note this is an abridged list but covers the intention of the policy. Workers are responsible for: Number 1. Abiding by CHEERS Code of Professional Conduct. Number 2. Being aware of site security measures and client support procedures and service needs so you can identify potential risks and know how to respond and keep yourself safe. Number 3, reporting any risks of workplace violence that you observe. Number 4, participating in required trainings, including workplace violence, harassment, and sexual harassment prevention education, and crisis intervention training programs, and requesting additional training as required. Number 5, immediately reporting and documenting all incidents of workplace violence, harassment, and sexual harassment, or threats of violence, harassment, sexual harassment, including circumstances of chronic mental stress or traumatic mental stress. Number 6, contributing to workplace violence risk assessments and surveys as requested. Number 7, sharing any information, personal or otherwise, that might impact safety at the workplace, such as restraining orders and/or safety plans that have been put in place. Number 8, workers are also responsible for employing controls and using measures that are made available to them, such as summoning immediate assistance when workplace violence occurs or is likely to occur, knowing how to use the telephone paging function to summon assistance at Cheers sites, knowing how to operate monitored alarm buttons and personal alarms, and knowing how to respond to a personal alarm activated by others, wearing alarm buttons when working alone at a Cheers site, and for those that work in the community, maintaining a charged cell phone readily available to call 911. Supervisors are responsible for monitoring for warning signs of workplace violence by being present at team meetings to observe team dynamics and checking in with workers during supervision meetings about dynamics with coworkers and any client-related safety concerns. Number 2, ensuring that safety and security measures and procedures are followed. Number 3, participating with staff in the development of safety plans when potential risks are identified. Number 4, identifying and alerting workers to violent persons and hazardous situations. Number 5, investigating and dealing with workplace violence incidents and complaints and following appropriate reporting procedures. Number 6, ensuring that workers have the training and resources needed to ensure their safety, such as the means to summon help. Number 7, coordinating a debriefing session with those involved in an incident of workplace violence by a skilled professional if required, and following up appropriately, including facilitating WSIB claims for traumatic mental stress and/or chronic mental stress as appropriate. Number 8, informing workers of the right to refuse unsafe work as per the procedures outlined in Cheers personnel policy, work refusal, and work stoppages. But please note that Cheers workers providing direct client support cannot refuse work if the risk is an inherent or normal part of their job and/or the refusal would endanger the life, health, or safety of another person. Managers and directors are responsible for, number 1, coordinating workplace violence investigations and ensuring that all reports of workplace violence are documented, investigated, and appropriately resolved. Number 2, ensuring that supervisors have been trained on procedures related to the reporting and investigation of workplace violence. Number 3, notifying the Joint Occupational Health and Safety Committee in writing within 4 days of any injury that disables a worker from performing their usual work or that requires medical attention. Number 4, participating in the analysis of workplace violence incidents, risk assessments, and prevention initiatives. Number 5, ensuring the implementation of the workplace violence prevention program within their program area. Number 6, facilitating an annual workplace violence risk assessment to evaluate potential hazards and recommended controls using the hierarchy of controls. Number 7, monitoring and analyzing data from hazard reports and employee incidents and client incident reports. Number 8, ensuring that all sites and teams have access to resources, equipment, and the security measures necessary. Response procedure. If you experience or witness an episode of workplace violence that threatens to endanger someone, the first step will be to determine if you need to call 911. Then, of course, initiate that call if required. At Cheers sites, workers can also summon immediate assistance by paging for assistance, activating a personal alarm, or activating a monitored alarm button. If the presenting danger is not immediate, inform your supervisor/manager or the on-call supervisor. Workers affected by workplace violence will be supported by Cheers to access medical attention if needed, facilitate debriefing, provide advice regarding resources within the community, the Employee Assistance Program EAP resources, making reports to the police, and WSIB reporting as appropriate. If emergency services are not required and the situation is under control, the employee will complete an incident report, which will trigger an investigation. The policy outlines the procedures and timelines required for investigations. Workplace violence risk assessments. Cheers has various ways of gathering information and obtaining staff input related to the risk of workplace violence, harassment, or sexual harassment. Hazard reports, incident reports, and subsequent investigations are one way to identify potential areas of risk or concern, but there are also more preemptive ways to assess risk. As you know, we often use staff surveys to obtain input and feedback. A recent one focused on the risk of workplace violence and asked questions such as, do you feel safe at work? Are you aware there is a system for reporting threats and violence at Cheers? Is your workspace designed to protect workers from workplace violence? The results of this survey was shared across the agency, including recommendations for changes, most of which have already been implemented. In addition, Cheers has developed a more formalized process for assessing our facilities and work practices within the context of risk for workplace violence. We have decided to use tools developed by the Public Services Health and Safety Association, as they are considered to be the gold standard in this area. We have reviewed a number of their tools and are incorporating various aspects into our practices, but the primary tool that we are using is the PSHSA Workplace Violence Risk Assessment Long-Term Care Toolkit. This assessment will be conducted annually at all Cheers sites and focuses primarily on the physical plant, work practices, and the mechanics of the job. For example, getting to and from work, our parking lots, security of our building, and work practices. A summary report will be produced and will include any recommendations for change according to the hierarchy of control. This assessment, the report, and the resulting recommendations are the responsibility of the senior management team, but will require input from workers at all levels of the organization. Assessing risk of violence as part of clinical practices. Given the nature of work we do, there is a risk of violence that is client-related, and therefore evaluating risk is embedded in our clinical practice in a number of ways. Starting with the intake process. Cheers intake team gathers substantial history at the time of referral, including any history of aggressive behavior. Information is reviewed with the intake committee, and any risks identified are highlighted for further assessment. Documentation is reviewed and additional information about client history is gathered when a client is admitted to a program. More fulsome assessment happens at this time. The clinical team is using a standardized assessment tool called START, the short-term assessment of risk and treatability, to evaluate a client's level of risk for aggression and likelihood of responding well to treatment. These results will guide information sharing and training for staff. If a risk is identified, one that we consider to be manageable given Cheers' service and supports, concrete guidelines for intervention and response will be documented and shared with all relevant staff. What is included in these trainings will depend on the client behavioral support needs, but will at minimum include the behavioral profiles, aggression continuum, and staff response forms from the SAFE management group. For those that work in the community, there is another process of assessment that evaluates risk in the client's home or surrounding community. The Home and Community Care Assessment is to be completed when services commence and annually thereafter, and/or if anything changes for the client or their living environment. The initial assessment should be completed with the service coordinator and perhaps a member of the clinical team if deemed warranted. These assessments gather information about the immediate and surrounding environment, safety of the building, access to secure places to park, easy and safe routes for entry and exit, as well as known history of aggression from the client, family, or anyone in the building. Once this assessment is complete, a safety plan will be developed to address any areas of concern that are identified, and may include things like check-ins, check-out calls with your supervisor, planning for safe commutes, or attending appointments in pairs if necessary. Working alone was identified as a potential hazard through recent staff survey and through the annual workplace violence risk assessment, and it is recognized that this is a common requirement within some roles, particularly for those staff that work in the community. As a result, Cheers developed a separate working alone policy. Within that policy, individuals are considered to be working alone when they may not have access to a coworker or other person in the event of an injury, illness, or other emergency. The definition for workplace is any place where business or work-related activities are conducted. This includes Cheers facilities, client homes, or community locations where client supports take place. It also includes work-related social functions, work-related travel, and work-related conferences or training sessions. Within this policy, workers are responsible to be aware of site security measures and follow recommended safety protocols. Ensure ready access to equipment required to summon help and summoning help when needed. Participate in required trainings. Report and document hazards and incidents of workplace violence. Participate in workplace violence risk audits. Conduct a point-of-care assessment during every community or home visit. Speak up about any concerns and develop safety plans when warranted, and review them regularly. Supervisors are responsible too. Ensure that staff are aware of and are following safety and security measures. Identify and alert workers to violent persons and hazardous situations. Collaborate on the development and implementation of safety plans. Ensure that resources are available to staff to minimize the risks of working alone. Complete investigation reports in response to employee incident or hazard reports. Your safety is very important to Cheers, and while we have outlined different formal procedures for assessing risk, we want to encourage you to speak out at any time if there is something that concerns you. Thank you for completing this training. Please ensure that you complete the assessment of learning at the link provided here. If you have any questions or comments on the training, please contact Michelle Graham at michelleg@cheers.com.